Welcome to the Private Practice Survival Guide podcast with your host, Brandon Siegel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Welcome back to the Private Practice Survival Guide. In this quick tip episode, I want to talk to you about strategies for evaluating a trailing KPI. You heard me right, a trailing KPI. So let's get into it. Defining your trailing KPI. Now, for those who don't know, KPI, key performance indicator. You got it right. Key performance indicator. So this is a metric that measures your historical, financial, or operational performance over a specific past period, such as last month, quarter, or year. It reflects what has already happened. That's why it's called a trailing KPI, but it is providing a retrospective view of the practice's results. So with the trailing KPI, an example of this would be my physicians saw a 97% arrival rate 3 weeks ago. 2 weeks ago, 87%. It's still a trailing KPI. So we're measuring that KPI from the past, and that's allowing us to evaluate what we need to change or keep the same. So that is our trailing KPI. So here are a couple examples just to kind of keep your blood boiling with this thing. So these are KPIs I like to look at. Revenue per session, that's a trailing KPI I measure, which is the total revenue divided by the number of patient sessions in the past period. Net profit margin, that's your revenue minus expense divided by revenue, expressed as a percentage for a given time frame. So that's where we're getting that net revenue, if that makes sense. Patient acquisition cost, that is marketing expenses divided by the number of new patients acquired over a period. So that is the patient acquisition cost as it relates to marketing, if that makes sense. So if I spent $500 and I got 5 patients from it, do the math, $100 per patient for the client acquisition cost. Expense to revenue ratio, total expenses divided by total revenue for the past period. Figuring out that division. So what's that ratio between expense and revenue? Collection rate, the percentage of billed charges collected from payers or patients in a set time frame. So one of the things with collection rate, I want 97% of collections within 30 days of date of service for all primary payers. That's a trailing KPI I want you to track. Appointment no-show rate, percentage of scheduled appointments missed by patients over a period. I could also flip that script and call it an arrival rate. So what is the arrival rate? So last week we had a 95% arrival rate. They're two different objectives, just so you know. So here are some characteristics that I want you to keep in mind. Historical focus, trailing KPIs are calculated using past data. They're unlike leading KPIs, which predict future performance, and they're data-driven. They derive specifically from financial reports, practice management software, electronic health records, and they're actionable. We can use them to identify trends, assess financial health, and inform future strategies. So I talked about this trailing KPI, and just because we're kind of in it to win it, I want to give you an example of a leading KPI. So a leading KPI would almost be like a forecasted KPI. So I may say, for example, I have 3 new practitioners starting at the beginning of the first of the year. And because of that, we should have a 30% increase in spike of revenue due to the production of those 3 people. That would be a leading KPI that I'm going to monitor if that becomes a reality. So why do we measure trailing KPIs? Well, it allows us to identify trends. We can assess financial health. It informs strategic decisions. It allows us to mitigate risks, and we're able to benchmark performance. The other thing is it allows us to evaluate effectiveness of past actions. So if I have a 20% cancellation rate within less than 24 hours, well, that's going to allow me to see, is my policy effective or not? And I'm going to start to look at what are the changes I need to make in order to fix that trailing KPI. It also supports long-term planning by having that track record. So I always hear, I don't know what I don't know, but you do know what you do know, which is your trailing KPIs. So recognize the value of that. So it's interesting. Have you ever traveled on a vacation to the same location a year later? Well, when you're attacking that second trip to that location, it's going to look different than year one. And that is your trailing KPI. So I'll give you my example just from the travel analogy. I started coming to Arizona I live in Florida, and I was traveling to Arizona. First time to Arizona, didn't know how long it took to get bags, didn't know how long it would take to get a rental car, all of those different things. Second time around, I was about 20% more efficient. I knew where I was going, everything. Third time around, I think I increased 10% efficiency over the second time because I'm like, now I know how to pack, what to pack, where to go, there, I know where to stop. I know where to eat. I know where I want my coffee, all those different things. I had the trailing KPIs of the historical data of what mattered to me. What mattered to me was, okay, I want to know where to get my rental car. Okay. I want to know where to get my coffee. Okay. I want to know how much energy I'm going to have. All those things allowed me to make better long-term planning for the future when I was going there. So here are some tips and tricks for implementing a trailing KPI evaluation process. So first, I need you to start with clear objectives. What are you trying to do? I got on the phone last week with two people and did what I call as a discovery strategy session. And they reached out to me like, Brandon, I think I need your help. I'm like, okay. And I asked a simple question. I said, what is the number one objective you have for your private practice in the next 12 months? They said, I don't know. That's why you're here. I'm like, okay. So the number one objective you have for the next 12 months is to come up with objectives for the next 12 months. That's your number one objective. It doesn't matter what the objective is, but you must have an objective. It is when we circle the wagon and we get paralysis by analysis that nothing gets done. So I need you to define specific goals for evaluating your KPIs. What are you trying to improve? Are you trying to improve profitability? Are you trying to improve expense ratio to revenue? Are we trying to reduce expenses? Are we trying to enhance patient retention? Are we trying to make employees love us? That could be a KPI. I want employees to lick the bottom of my feet and say how great I am. I hope that's not your goal, but it's an objective. But it could be staff retention. It could be staff referrals. It could be, there's a lot of ways. So I want you to align your KPIs with your practice's strategic priorities. Cash flow may be a concern. So we're going to prioritize collection rate and revenue per session. Why does this work? Because clear objectives keep the process focused and ensure the selected KPIs are relevant and, you got it, actionable. The next thing I want you to keep in mind is we need to select a manageable number of KPIs. I am so exhausted of you coming and saying you're tracking 100 different KPIs and you're tracking stupid KPIs like how many times the phone rang. Choose 3 to 5 to start. I want you to evaluate at a time to avoid data overload. Get 3 to 5, go from there, get it implemented, and then you can add to it. I literally was just telling someone minutes ago, I said, there's give or take a couple dozen KPIs that we're actively measuring. And I use the analogy, when we drive our car, we measure 3 to 4 KPIs. And when the tire blows out, we add new KPIs because of the tire blowing out. Sometimes we're trying to measure so many KPIs that we don't even see that the tire blew out. So we need to use a mix of financial and operational KPIs to get a holistic review. Financial would be like net profit or times number of days to collection or whatever that may be. Holistic view may be appointment no-show. And so a focused set of KPIs are going to simplify your analysis and make it easier to act on your findings. So when you call me and you say, Brandon, I think you may be able to help me, I want you to have the clear objective, even if the objective is to define your objectives. We need to leverage technology better for data collection. We have to use our practice management software. We have to get creative. So I love AI for data collection, provided we can audit it. When data is wrong, that's dangerous. So making sure we have the right technology is really important. Set up your recurring reports in your software, monthly revenue, billing reports, minimal manual effort, and get it going. And that automation will save time, reduce errors, and ensure that data is readily available. We need to standardize our data formats, organize them in a consistent format, create a template and a KPI so that you have benchmarking comparisons. By standardizing your format, it makes it easier to spot trends and compare performances over time. I still use the same 2018 stat sheet for one of my companies because I love it. And it's standard, and I can look back and I've got all that right there, 2018 to present, really clear, standardized, rocking and rolling. We need to schedule regular evaluation sessions, and we need to visualize data for quick insights. And by benchmarking against relevant standards, we're able to evaluate our comparison of how we perform to the industry mark. And last, but certainly not least of this, we need to involve our team. Get your office manager involved. Get your billing specialist involved. Get your consultants involved. Get your HR involved. Do all the different things to get your team going and growing. I want you to focus on actionable outcomes. What can you actually do? Use a simple action plan template. KPI, issue, action, owner. What are we measuring? What's the issue? What are we going to do about it? Who's going to do it? Actionable outcomes ensure the evaluation process translates into tangible improvements. And then we got to monitor and refine it. So every 6 to 12 months, we got to be looking at, are we measuring the right stuff? Are there holes in what we're measuring? Are there holes in what we're not measuring, etc.? And so we address those gaps proactively, and we continue to educate ourselves and our team. We consult experts when needed. We document, we track our progress. And so, did you know that 82% of private medical practices that consistently evaluate trailing KPIs, such as revenue per full-time equivalent physician and patient encounter trends, report improved financial performance and operational efficiency within 2 years? That was from MGMA. That statistic, that is an example. I mean, literally, 82% of practices are finding improved financial performance and operational efficiency within 2 years for just tracking trailing KPIs like revenue per full-time equivalent physicians. Very valuable. And last but certainly not least, I want you to know, in the words and inspired by Peter Drucker, trailing KPIs are your business's rear view mirror. Study them to understand where you've been so you can steer confidently toward where you're going. Thank you for tuning into this episode of the Private Practice Survival Guide podcast. Together, we can thrive, not just survive. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you love this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.